Hi viewers, today we are going to see the topic of interview tips in HCC coding. We hope this tutorial will helpful to crack the interview by 100%. It is applicable for both freshers and experienced people. Let's see the eligibility requirements. Freshers. Life science graduate, like doctor, nursing, biotechnology, biomedical, pharma, and so on. Other degree holder also is eligible, if they have the additional medical coding certification by AAPC or AHIMA. The major medical coding certification is CPC, CCS, CRC. Experienced. IHCC experienced. Other specialization professionals also eligible, if they having ICD10 experience, like ED, E&M, radiology, surgery, and so on. Interview selection process. Here, 3 stage of questions will be there. The coding manager will check the coder knowledge in 3 stage. Let's see. 1. HCC coding, 2. ICD10 knowledge, 3. Medical background knowledge. Here, we covered all possible question. We sure, it will more helpful for you to perform in best way in the interview. Even the freshers and other specialization experienced people, if they know this, we sure they can crack the interview 100%. The possible question we listed below by section wish. We discuss each question in detail in following slides, in which you can expect some 4 to 5 question in the interview. Let's see. Number 1. HCC coding. What is HCC coding? It stands for Hierarchical Condition Categories. CMS uses HCCs to reimburse Medicare Advantage plans, like Part C payment, based on the health of their members. The cost expenditures of patients is based on demographic information and patient health status. The risk assessment data used is based on the diagnosis information pulled from the claims and medical records, which are collected by physician offices, hospital inpatient visits and in outpatient settings. So try to remember, these are the medical record is reportable for HCC coding. The rest like radiology report, pathology report is not eligible for HCC coding. List out the HCC payment system. In Medicare, there are 2 payment model is there, they are CMS HCC, Center for Medicare and Medicaid Services Hierarchical Condition Categories, for Part C payment. RX HCC, Prescription Drug Hierarchical Condition Categories, for Part D payment. Medicaid. CDPS, Chronic Illness and Disability Payment System. Medicaid RX. Commercial. HHS HCC, Health and Human Services, Hierarchical Condition Categories. CMS HCC versus HHS HCC. CMS HCC for Medicare insurance. HHS HCC for commercial insurance. CMS to pay Medicare Advantage, Part C, for enrollee. Used by CMS to pay health insurer in Affordable Care Act marketplace. CMS HCC is applicable for the people age greater than 65 and above, or disabled people. HHS HCC is applicable for all age group. CMS HCC is prospective model. That means, the current year diagnosis data is used to determine the next year's rate. HHS HCC is concurrent model. That means, the current year diagnosis data is used to determine the current year expenditures. ICD. The overall ICD10 code is about 70,000 codes, in which only 9548 ICD code having HCC values in CMS HCC. In HHS HCC, only 7768 ICD code having HCC values. There are 79 HCC category is there in CMS HCC. There are 127 HCC category in HHS HCC. The HCC range is from 1 to 189 in CMS HCC. The HCC range is from 1 to 254 in HHS HCC. Example of HCC condition. HIV/AIDS, the HCC is 1. Diabetes mellitus, the HCC is 17, 18 and 19 based upon the severity and complexity. Try to remember the rest of the condition, it will be useful for you at interview. Even you no need to muck up the HCC value. Condition itself is enough. What is the risk adjustment and risk score? The risk adjustment model uses a patient's demographics and health status to determine a risk score, which is a relative measure of how costly that patient is anticipated to be. Risk score equal demographic, which includes age and gender, plus health status, which includes diagnosis and disease interaction. The average risk adjustment factor, RAF, score is 1. If RAF is less than 1 means, healthy patients. If RAF is greater than 1 means, unhealthy patients. So revenue from the insurance premium is transferred from healthy patients to patients with an above average RAF score. What are the acute conditions should not capture in outpatient setting? CVA/cerebral infarction, cardiac arrest, brain hemorrhage, diabetic ketoacidosis with coma, anaphylactic shock, unstable angina, sepsis/SIRS/septic shock. Meet and tamper. Let's see the definition for meet. M denotes monitor, which includes signs, symptoms, disease progression and disease regression. E denotes evaluation, which includes the test results, medication effectiveness and response to treatment. A denotes assess or address, which includes the ordering tests, discussion, review records and counseling. T denotes treatment, which includes medications, therapies, other modalities. In tamper only P and R it added extra. The rest is same as meet. Let's see. P denotes plan, which includes plan for surgery, plan for active line of treatment. R denotes referral. Example, refer to specialist, like oncology. Number 2, medical knowledge. Human anatomy and physiology, which includes 12 body system and their function. The coding manager will ask you to explain any 2 body system, or they ask any particular body system directly. So make aware about the all 12 body system with their function. If you want to know that 12 body system means, check the link in our video description or click our channel icon. Internal organs. They may ask you to explain any organ with their function. Example, digestive system. Here you first explain the meaning of digestion, then explain what are the anatomy and body organs involving in digestion process with their function. Medical terminology. Medical terminology is the language used to precisely describe the human body including its components, processes, conditions affecting it, and procedures performed upon it. Medical terminology has quite regular morphology. The same prefixes and suffixes are used to add meanings to different roots. The root of a term often refers to an organ, tissue, or condition. For example, cardiology. Cardio denotes heart, ology denotes study of. The final meaning is study of heart. Otorhinolaryngology. Oto denotes ear, rhino denotes nose, larynx denotes throat, ology denotes study of. The final meaning is study of the ears, nose, and throat. The other few example we listed below for better understanding. Number 3. ICD-10 centimeter, which denotes International Classification of Disease 10th Revision Clinical Modification. While coding, what are the things we need to check? There are list of terms and instruction note including general ICD-10 guidelines. You need to ensure those while coding. They are: code first, includes note, excludes one end, excludes two. Let's see with example for better understanding. Code first denotes for, you need to code the main condition first, then followed by this code. Here if the patient is pregnant means, you need to code pregnancy complication first 099.4, then you need to code I42 series code. Includes note denotes for some list of condition it's already included based on synonyms. Here myocardiopathy is included in I42 series. Excludes one denotes, not coded here. An excludes one note indicates mutually exclusive codes, two conditions that cannot be reported together. Excludes two denotes, not included here, which indicates that the condition is not part of the main condition. So we can report both conditions at the same time. So if document supports, we can code ventricular hypertrophy as well as the cardiomyopathy. Symbols. List of symbols, which helps to identify the gender and age-specific code. Here M denotes for maternity. This symbol indicates for female code. Use additional code. This is additional code, we can code with main code for more specificity. Guideline related to major HCC condition. What is the recent update in ICD10 Guidelines? Myocardial infarction. A heart attack happens when the flow of oxygen-rich blood to a section of heart muscle suddenly becomes blocked and the heart cannot get oxygen. Here there are 5 types of myocardial infarction is there. The explanation and cause of myocardial infarction, we listed below. Let's see the coding guideline for myocardial infarction. Within 4 weeks or 28 days only, we should code it as acute. If beyond 4 weeks means, we should be coded as old or healed MI, the ICD-10 code is I25.2. Let's see the flow chart for better understanding. K. Within 4 weeks, after initial MI, if one more MI occurs means, we need to code that additional MI as subsequent MI, but subsequent code only is there for type 1 and for unspecified MI, so, for other types, we need to use appropriate MI code from I21 series. New updates in 2019 ICD-10 guideline changes is, while coding 2 different types of MI, we need to lead all code in I21 series, even type 1 MI having subsequent code. If both are type 1 MI means, we can code I22 series for subsequent MI along with I21 for initial MI. Let's see the example for better understanding. Example number 1. On January 14, 2019, the patient had the type 1 STEMI at anterior wall. On January 22, 2019, patient had one more MI in inferior wall, STEMI. How you report? Guess it, what will be the answer? Yes, correct, the answer is I21.09, I22.1. Because here the patient has the subsequent MI and initial MI are same type and also it happens within 4 weeks of initial MI. So we need to report 2 code. The subsequent code is from I22 series. Example number 2. On January 14, 2019, patient had the type 1 STEMI at anterior wall. On January 22, 2019, patient had one more MI as type 2. How you report? Guess it, what will be the answer? Yes, correct, the answer is I21.09, I21A1. Because here the patient has the subsequent MI and initial MI are indifferent. So we need to report 2 code from I21 series. Diabetes. We need to assume and code the cause and effect relationship for specified condition as per ICD-10 guideline, even the provider not linked also. The example condition we listed below. Here with is denotes for due to. For example, the patient has DM and CKD. Here there is no cause and effect relationship is mentioned by provider. But as per the ICD-10 guideline, we need link a CKD due to DM, so the ICD-10 code will be E11.22. Hypertension. We need to assume and code the cause and effect relationship for specified condition as per ICD-10 guideline, even the provider not linked also. The example condition we listed below. 1. Hypertension with heart disease. It may be a heart failure or condition from I51.4 to I51.9 series. 2. Hypertension with chronic kidney disease. 3. Combination of both CKD as well as heart diseases. Other diagnosis. Cancer. Like breast, prostate, lymphoma, myeloma and leukemia. Late effect or sequelae of CVA. The sequelae we listed here. It will be helpful for you to give an example in the interview. We plan to upload the 12-body system with explanation in simplified way in few days. And also we plan to cover the same thing for other coding specialization like ED, radiology, and E&M coding. So, stay connect with us for more updates. PPMP Creative System. For more updates, please subscribe us. And also, your feedback is more valuable for us. Please comment your feedback or any suggestion, or if you want any more clarification also. Thank you for watching. Stay connect with us for more updates. See you on our next video, where we will see with more informative and interesting topics.